speakers. I'm really happy to have them here today. We have Olivia Ingalsbe. She's from the Rural Health Network at Ellenville Hospital. She's the Population Health Program Coordinator. She's going to talk about the New York State of Health Marketplace. I'm really excited to hear about that. Continuous coverage and how to maintain health coverage through Medicaid and CHIP, which is very, very important. I mentioned it before over the summer, that it's a process. It's during COVID, people didn't need to renew, and now they need to renew. And I'm really happy to see Karl Pizza here. He's also from Ellenville Regional Hospital, and he's the financial counselor, and he's going to talk about financial assistance available through the hospital and the process for seniors that have Medicare but might wish to apply to Medicaid. So afterwards, there'll be a chance to ask questions. And I don't know who wants to go first, but take it away.
Hi, everyone. And actually, I'm wondering, can I get access to or maybe, yeah, would I be able to get access to screen share? Thank you.
Yeah, give me a couple of
Yeah.
seconds.
And while you do that, I'm just gonna put both of our contact information in the chat so that anyone can reach out.
Okay, I'm making you the host, Olivia, so when you're done, I'll take it back in
Okay.
case Carl. Okay.
Perfect.
So you should be able to share now.
That sounds good. One moment. And then what I'm also going to do is we're going to have, if everyone would be able to fill out this little, it's a one question as a pre-survey.
Is it in the chat?
I'm going to add that
Oh,
in
okay.
right now. So I'll give, before I start the presentation part, if everyone wants to fill that out, and I'll give a little introduction. So like Harry had already mentioned, Carl and I both work at the Ellenville Regional Hospital. I work with the Population Health Department, and Carl works with the finance department. And so I recently got trained through New York State of Health as a certification certified application counselor to help with the unwinding of continuous coverage, which we'll get into a little bit more. So that's kind of why I'm here presenting on this. Outside of that, we also offer free fitness classes. Our nutritionist, Brittany Raitano, offers free nutrition coaching. And then we also do have a grant that focuses on cancer screening outreach. So trying to call people and get anyone that's not already getting screened or needs any assistance getting connected to cancer screenings for breast cancer, colorectal cancer, cervical, and lung cancer. We also can offer tobacco cessation if any of you know people that are interested in quitting or even just starting that conversation. So a little bit about that. And then Carl, if you want to introduce yourself quick.
I'm Karl Pizza. I work in the finance department. I am the finance counselor for the Ellenville Regional Hospital and the Medicaid billing specialist. I work with Olivia. We do Medicaid applications, and I also do the financial assistance applications, which we offer to population of Ellenville and our surrounding areas to help afford their health care, to help afford what patient responsibility may be.
I'm just going to interrupt for 1 minute. I want you to know, both Olivia and Carl, that this meeting is being recorded. So we don't have a ton of people tonight, but this is going to be on YouTube, and we've had in the past that these meetings that we record have a wide audience. So I want you to know about that. Also, Carl, I think you called in 2 ways. So on the screen we see the phone, but I know we can see you. If did you call in to the Zoom meeting 2 ways?
No, I just called in the once because.
Huh. Okay, that's all right. Your face isn't coming up on the screen, although I can see you. It doesn't matter. Let's go on.
All right. I guess since this is being recorded, should I say out in the chat, or should I say the contact information that I put in the chat out loud? Would that be helpful?
Yes.
Okay, great. So for anyone that would like to reach me by phone, you can call me at 845-647-6400, extension 281, or by email at OINGALSB as in boy, E as in Edward, at erhny.org. And you can reach Karl Pizza at 845-647-6400, extension 322, or by email at kpizza@erhny.org. All right, and I'll share my screen now. Bear with me while I figure out how to make this bigger. Okay, can everybody see?
Yep.
Okay, awesome. All right. So yeah, I guess to go over quick, some talking points that we're gonna go over today is just talking about what New York State of Health is, the insurance types you can receive through New York State of Health, the meanings of continuous coverage and what it means to have the unwinding of continuous coverage, how things you can do to make sure you're insured, or if you're not insured, how you can take steps to become insured, some important dates to know about, available resources, and some financial assistance, and then like an overview about the financial assistance at the Ellenville Regional Hospital, and then some Q&A set part. All right, so going into an overview of the New York State of Health. So basically, New York State of Health is a website that the state runs that allows people to apply for health insurance, specifically families and individuals, or like adults. And Karl and I are both certified to offer assistance to anyone because the application isn't too tricky, but it can be, there's a lot of different steps to it. So sometimes it's nice to just have someone else there that can talk you through it. We're able to do this assistance in person or over the phone. So if you're not able to come in person, that's completely fine. We can just do a phone call. And we are able to get your information or your account uploaded to our New York State of Health dashboard, which allows us to see your account and make changes and talk you through it as you're applying to the marketplace. And what you first do is you don't just apply for the specific coverage first. You apply to the marketplace, and you give them all the information they ask for, and then the marketplace tells you what you're eligible for, and we can go through the plans and see what makes sense for you. Thinking about things like what primary care providers you're already working with, or any doctors you have and trying to see what's already in your network, and then matching that with insurance that will offer those. Or maybe it means looking and finding new doctors that will be a network with the insurance that offers the best plan for you. Karl, do you have anything you want to add in here?
No, not right yet.
Okay, great. So going to the next section, there's 4 different types, insurance types that can be applied for on the marketplace. So there's Medicaid, so primary insurance only, the Essential Plan, Child Health Plus. Both Medicaid and Child Health Plus do not have open enrollment restrictions, just a little tidbit. And then the Affordable Care Act, which is currently still in open enrollment and will remain open through May 31st of 2024. Karl, do you want to talk a little bit more about details here?
Yeah, with Medicaid, the Essential Plan, and Child Health Plus, like Olivia said, they're open all year round, and we can help people apply throughout the year. So if you need those kinds of insurances, that's something we can do without the restrictions. The Affordable Care Act sometimes has restrictions, which will come into play later on next year.
And Karl, correct me if I'm wrong, but something I didn't put in here is that also if someone has had like a major life change event, I believe that'd be death, birth, changes in jobs or like housing, those events also can qualify someone to enroll outside of those restrictions. Is that right, Karl?
Yes, That's true. If any of the major life events will allow you to bypass the restrictions that the Affordable Care Act sometimes does have.
Right. Okay, so that's something to keep in mind too. If someone doesn't have insurance or if they lost their insurance and have had a major life change, that's also there's I want to encourage people to reach out and we can help figure out what that process will look like. All right. So yeah, now going into what continuous coverage is and what the unwinding of continuous coverage means. Harriet described it pretty concisely, which is nice in the beginning. So basically, continuous coverage was a response to COVID-19. So when COVID's first happened, it was the government's plan to try to keep everybody insured and to just make it as simple and easy as possible to keep people enrolled in healthcare coverage. And it was a federal requirement. So states were not allowed to end Medicaid enrollees coverage until the end of the public health emergency was declared. So that meant that if someone had not like submitted certain documents or didn't reapply or recertify like you had to do before COVID started or was declared, that meant they weren't going to lose their healthcare coverage. It was continuous. No updates needed to be made and needed to be made. And states did this with the hope of keeping as many people insured as possible. Now that the public health emergency ended as of March 2023, this time period is considered the unwinding of continuous coverage. So getting back into the routines of recertifying and sending in documentation that that states are requiring to recertify health insurance that was done just like before or pre-COVID-19 processes. So this includes annual Medicaid eligibility reviews where individuals are expected to recertify and reapply and send in documents requested. And that will be, and so the process is about 14 months long. And if they aren't able to recertify or reapply, then they'll lose their coverage. So Carl and I are especially here to make sure people are aware of that. And if they aren't aware and need any assistance or like any help with recertifying or coming up with a way to try and find ways to make sure they're certified, that's what we're here to assist with. Let's see. Going into the next section, I'll pass off to Karl for open enrollment and renewal important dates.
Okay, open enrollment is open until further notice due to the COVID-19. This will eventually shut down and the special enrollment period will come into place. Marriage, divorce, death, birth, moving into the area, moving from one area to another, change in job status, stuff like that. We are currently in the open enrollment period for New York State, started November 1st. For now, we can do the open enrollments for January 1st up until December 15th. After December 15th, if you get Affordable Care Act coverage, that coverage won't start until February 1st. So if you need to do an application, we do the application up until the 15th of December, and then after that, that will give you coverage for January 1st of 2024. And then after the 15th, it's then February 1st, so the cutoff date in every month is the 15th of each month.
All right, great. Thanks, Karl. All right, so going to the three different types of renewals. There's automatic renewal with auto enrollment where no action is required for renewing. There's automatic renewal without auto enrollment, so there is an action required, so you have to select and enroll in your plan for that year. And then there's manual renewal where actions required and the consumer has to update their application. They'll tell you which information it will be needed for that update. Do you have anything you'd like to add in here, Karl?
No, not right now.
Okay, great. And then Karl, I'll pass this one off to you again.
Okay. With the Affordable Care Act through the New York State of Health, there are multiple different plans that you may be qualified for. If it's Medicaid, if it's Essential Plan, if it's Child Health Plus. There are certain ones that are in each county that you're in that will allow that the state is contracted with to provide those insurances. With the Affordable Care Act, if you qualified for the Affordable Care Act, there are different levels of plans. There's the bronze, silver, gold, and platinum. The bronze is a little cheaper and has a higher deductible, and the platinum plans are the most expensive, but they have no patient deductibles. So it all depends on where you qualify, and what you qualify for is how we can help you get your insurances. There is a catastrophic plan that is restricted to younger individuals who may not need insurance. The younger you are, the less likely you are to need insurance, I guess. So that's the catastrophic plan. And like I said, the Medicaid managed and CHP plans, essential healthcare plans, are, each county has a different set of them. And those are the plans that can help you enroll with.
Thank you. Then we did get a question in the chat about how you can auto enroll. So I just want to go back to that side. Oop. How can I? Sorry, going wrong way. Okay. So for auto enrollment, and Karl, correct me if this is inaccurate, but I believe the type of renewal that you would have to do depends on the plan that you were eligible for and the plan you selected. So it's not something that you can necessarily go into your account and pick one of these three. It's kind of something that's predetermined on that by the New York State of Health Marketplace. Karl, is that accurate?
Yeah, the auto renewal, if the state through its resources can identify that what you have is the same, what your income is for the next year going to be the same as it was, then they'll auto renew you and no action will be required, including insurance. Sometimes insurance companies change. They come onto the marketplace or they go off the marketplace. So that's what the auto renewal does. The other two breaks it down to varies within that set of circumstances. It all depends on what the state sees when the renewal time comes around.
Thank you. And if there's any follow-up questions on that, please feel free to put them in the chat and we can continue to talk about it in the Q&A also. Next slide. Again, Karl, I'll leave this one to you, but the 2023 income guidelines. I know it's kind of small and hard to read, so I apologize about that.
This one's a little smaller and hard to read. What you can do, if on the New York State of Health, all these resources that we're showing you tonight is actually available on the New York State of Health, including the 2023 income guidelines. So you can go onto the website and you can see this a little better. Basically, this breaks down what you may be eligible for depending upon your income and how many people are in a household. Family sizes on the left, and how much you make a year is on the top. So that'll give you what you could potentially qualify for if you want to take a look prior to prior to applying. Sorry if I started a little bit prior to applying. There's also a way online on the New York State of Health to put in your individual information, and it will break down what you may be eligible for. It takes just some basic information, and it gives you a good idea of what you may cost, what it may cost, what you may be qualified for, and anything else, Olivia?
Okay, great. Sorry, I wasn't sure if you were still going or not. Okay, awesome.
No.
Actually, Karl, would you want to put a link to that in the chat for anyone to be able to reach? Or if you're able to do that? Oh, because you're on your phone.
I actually don't Yeah, I'm on the phone, so I don't think I'll be able to do that.
Okay,
But
when I
I can
exit,
send out a
the,
link if you.
yeah, perfect. Or we can send that to Harriet, and Harriet, would you be able to send that out?
Absolutely.
Okay, wonderful. So we'll send that to afterwards, and anyone that's interested can do that. Okay, great. All right, so yeah, going into the Medicare and Medicaid, applications for New York State of Health for those who have Medicare and do not yet have Medicaid are done through the County Department of Social Services, or DSS, in the county that you reside in. So if anyone that's in Ellenville would be Ulster County. And applications are available online as well as in person at each county DSS. So this I'll pass off to Carl too. He's a little bit more versed in this.
With the population who have Medicare and are looking to apply for New York State Medicaid. There's a paper application that can be done. I do keep applications here on site. If anybody wants them, please drop me a line and I can send them in the mail out to you. Those are done. They're filled out. Grab your documents together. You can mail it to the county, or you can bring it down to the county, which is on Ulster Avenue, Albany Avenue, whatever it is down there in Kingston, and you can drop it off. You can mail it down to them, and that application, they'll review it, and then hopefully you can get Medicaid if you think you qualify.
All right, wonderful. And then enrollees 65 and older. I'll also give this one to you, Carl.
During the pandemic, there were enrollees who had Medicaid who wind up getting New York State, who wind up getting Medicare while they were eligible during the pandemic. What'll happen is they've given some time to allow that change. So if you have already receiving emergency Medicaid through the New York State of Health and turn 65, you may continue to be able to receive it as long as you remain eligible. And if you're enrolled in an essential plan, you will be referred to the local Department of Social Services the month before you turn 65 to have your eligibility redetermined for New York State Medicaid. The counties do, in most cases, the counties do take care of that, rather than New York State of Health.
Did you see there was a question in the chat, Olivia?
Yes, and we're
Okay.
just about, I think we're gonna, that might be the next slide.
Great.
So how you can make sure you're still insured, and so that's a great, I see, sorry, I'm just gonna read the second one. Okay, great, another great question too. Yeah, so two great questions. The first, when will you need to re-enroll for Medicaid? And then the second one is, should we be aware of calls stating that they can help us get the most out of benefits? So to answer the first question, when it comes to re-enrolling in Medicaid, the thing that can be most beneficial for you to do is make sure that Medicaid or New York State of Health has your current mailing address and phone number, so that or email, depending on whether you're going the paperless or paper route for getting your notices, because New York State of Health will be either emailing you or sending you a letter in the mail saying that it's time to recertify. So keeping your eye out for that. A lot of those probably have already come in. It depends on when your plan started, when you started your coverage. But keeping your eye out for that and making sure your contact information is up to date so that they can actually reach you. And then once you receive those notices, not ignoring them and renewing the coverage as soon as you receive them. And if that's something that you're having a difficult time with doing on your own, that's when you can call Carl or I. You can also just call the New York State of Health phone number, which we will also send to Harriet so that she can send that out to everybody. And then and then yes, if you're no longer, if there's any changes that affect your eligibility for the health coverage you had throughout COVID and prior, like if you had a job change and that increased your income level, so you're no longer eligible for the healthcare plan you had before, then we can also assist you in choosing a new one. And then to answer the question about being aware of calls stating that they can help get most benefits out, and tips on how to receive and get all benefits that Medicaid offer. Okay, so yeah, so I would definitely be aware, I know, of any phone calls. Specifically New York State of Health will not be calling you in that way. They'll be sending you your notices through the mail or through email. And through email, also be careful, just make sure that the addresses that you're if you're receiving a mail saying that's New York State of Health, just making sure it's the actual address and not some weird one where it's popping up with the subject line looking like it might be at New York State of Health, and then in the email address itself having it be, usually it'll be some, I don't know, I'm trying to think of an example, but something that's not the actual New York State of Health email. And then for the calls, definitely don't give out, they won't be asking for any personal information over the phone. I know there's been a lot of fraud around that. So keep your eye out for those things, but mostly notices should be coming through mail or email, or US Postal Service or email. And then for tips on how to get and receive all benefits that Medicaid offer, or should we contact the case manager assigned? Karl, do you have any more insights on that side of things?
For benefits for New York State Medicaid benefits, if you're looking to see what New York State Medicaid covers, you can go to the New York State Department of Health. It's at www.health.newyork.gov/healthcare/Medicaid. And on that, it gives you a good overview of what Medicaid has and what Medicaid may offer, including the ability to check Medicaid eligibility. There's a link there to check Medicaid eligibility. You should be able to find it online. If you have specific questions about New York State Medicaid, I can try to answer them. I can try to answer specific questions based upon the Medicaid billing aspect of what I do here at the hospital. But really, your best bet is to look online at the Department of Health. They're the ones who set out the Medicaid eligibility and the benefits, and all major Medicare, Medicaid managed plans will have the same type of eligibilities. It may change depending on the insurance company you go with. It may change the network of doctors. Each insurance company has a different network of doctors, but the basic benefits should be the same across most all the Medicaid platforms.
Great, thank you so much. And Kendra, if you have any follow-up questions, or if anyone else does, once again, please put in the chat. We'll answer as best we can. Okay. So I guess I did put the phone number in here. And so I can email that to Harriet too, to put in email form to send out, but you can call if you have any questions that you would like to talk to New York State of Health specifically about. You can call 1-855-355-5777. So I forgot the last 7. So again, that's 1-855-355-5777. And you can speak with a New York State of Health representative. Or you can also always meet with Karl or I to go over your application. Like I said, we can either create, whether if you haven't met with the New York State, if you're looking to enroll insurance and you've never had a account with New York State of Health before, we can help you create one. And if you currently have health insurance and you already have your account set up, we can get access to your application so that we can see it while we're talking with you and working with you, and help you make updates to it. What are other over the counter free Meals on Wheels. Carl, do you know specifics to the like perks that are included in Medicaid, like over the counter items or free Meals on Wheels?
I actually don't have that information. In New York, the Ulster County Department of Social Services, it may be on their website. I don't have that specific information on the extras that New York State Medicaid does cover. What covers New York State Medicaid can cover transportation, but in that specific benefit, I'm just not sure of.
Thank you. Okay, yeah, medical devices, walker, ACE bandages, blood pressure cuffs. That I don't know the answer to that either, unfortunately, but that is something we can certainly look into. I will make note of that. And we'll get back to Harriet to send out what we're able to find on that.
Yep. If people have questions, you can also just ask them.
Yeah.
You don't have to put it in the chat, right, Olivia? Would
Yeah, I
that
was
be
gonna say
okay?
we're absolutely, yeah, we're almost at
Yeah.
the end here anyway. So I was gonna say, and I'll let Carl go through his financial assistance spiel that's more Ellenville Hospital specific. And then at the end, yeah, then we'll be at our Q&A.
Great.
Thank you.
Ellenville Regional Hospital, as financial, my main job here at the hospital is financial counselor for the hospital. I coordinate with the help of my supervisor, I coordinate the financial assistance that the hospital offers to our patients. Those we offer to the insured and underinsured. If you have high copays, high deductibles, high coinsurance, we may be able to help you. We offer it also to private pay if you don't have insurance. It's not what the financial assistance is not insurance, but it can help limit the amount of patient responsibility there may be if you have a hard time, if you have we try our best to offer what we can to help the patients and the population afford their health care. The overriding part of the financial assistance is under a state law. It's the state healthcare financial assistance law. That's the overriding law that each hospital has to have, and each hospital does have their own version of financial assistance. So all hospitals are required to have one. Ellenville Regional Hospital has ours. You can find that our policy, our application, and the requirements of what you need to apply when you are applying on our website. It is on our website. The link is here under the applications part. You can call me or anybody in patient finance. We can send you the applications. We keep them upstairs. They're also at the point of registration. Should also have a copy of the financial assistance application if you're currently being seen. Anybody is eligible to apply. We don't have restrictions. If you live in Ulster County in our operating area, we can definitely try to help, and it's something that we have updated. It is something that we do try to do the best we can to help in any which way we can.
Okay,
Wonderful. Thank
Harriet,
you.
if they finished, could you put the agenda back up? Because I think the next thing on the agenda is question and answer.
Excellent. I will stop my share then. Great.
So I'm gonna take back host.
Sounds good.
That was really, really informative and very well presented.
Yes.
Easy to follow. Thank you
Mhm.
so much.
Absolutely. Thank you. Thanks for having us.
Okay.
For having us.
All right. I'm going to
Can I
Sure.
say something right quick?
Yeah, of course, this is question and answer, so go right ahead.
Okay, yes, I wanted to just thank Miss Olivia and Mr. Carl, and I thank you for your fast response. And you guys were on it. You are definitely professionals. And whenever I contacted you guys, I just want to thank you for responding so quickly and giving us all of that information. It was very, very informational. I appreciate it.
Oh, thank you so much for sharing that. And also, sorry,
Thank you very
I'm
much.
just seeing your other question about how long the process takes. And so I'm going to say that varies pretty drastically depending on the scenario. So I know I'm a little bit newer starting with this, so I'd say I've had some applications that we do in one day and it just can take about an hour, and then there's some that can take weeks. So it kind of depends on what information, because sometimes you submit all your information and New York State of Health has no questions, everything, because when you're submitting everything, it gets matched with other, like, your personal identity information through like things like Experian. And if for whatever reason the information that we put into the application doesn't match to the information that they find through Experian or through their background checks, then they'll have to ask for follow-up questions. And sometimes that process can take longer because you have to upload the information to your application, and then that has to process, and then New York State of Health Marketplace has to approve or ask for more information. So that can end up taking some time. But then, like I said, on the other end, if everything matches and it's all set, then it can be pretty quick. So it's not a very straightforward answer, so I'm sorry about that. But yeah, Carl, do you have anything to add there?
It's basically the only thing I would add is when we do the applications in New York State of Health, because they use IRS and the State Department of Finance websites, their information that they have, if it's like Olivia said, if it's matching, then we'll have an answer. We could have an answer for you by the end of the application. Other times, it could take a few days, especially have to upload it. This time of year, maybe a little longer because it's open enrollment season. But most of the times, we should have a pretty quick response. Knock on wood.
Yeah, again, thank you for your great questions, Kendra. And if anyone else has any, please ask away.
Are there any more questions for our panel?
I just want to verify that this assistance that you give, this is for anybody in the community. They don't have to be a patient at the hospital, correct?
For the financial assistance, or
Well,
the
for
New York State of Health?
Yeah, New York State of Health, Medicaid renewal, things like that.
That's a perfect question. Very important part. Yes, that is free to anyone. You don't have to be a patient in the hospital. The financial assistance side that Carl talked about on that last slide, that's specific to the hospital, and that you need to be a patient for. But for the Medicaid or Child Health Plus, anything like that, that's free and open to anyone, and we encourage everyone to reach out.
Wonderful. Thank you for clarifying that. Yes.
And I'm also just going to send a post survey link as well. If everyone's able to fill that out as things are winding down, but please ask more questions if you have any.
Does everybody know how to fill out the survey? It's very easy. Just go to the chat, click on the link, and there's just one question. If you could all fill it out. I'm sorry, Olivia, I missed the pre-survey question.
Oh, that's okay. I think the link's still in there. it's the same, it's pretty much the same question. Just the thoughts on before. Do you want me to put the pre one in again?
If you want us to fill it out,
Yeah.
you know, okay, sure, I can find it. If everybody could do that, that's useful information for them.
Yes. Thank you.
Lisa, I have to call you back.
Here it is. Is everybody able to navigate that?
Yep, all done.
Wonderful, thank you.
I got mine.
All right.
Thank you so much.
I didn't get mine. I didn't see it.
Yep. Did you go to the chat?
Oh, thank you.
And click on the link.
The survey link.
Yes. Yeah. So there's one that says pre-survey link. So that's, I guess, when you're taking, if you didn't do it before, just thinking about like before the presentation, what your thoughts were and how you're assessing your knowledge of New York State Health or financial assistance available. And it's just one question, and then it's the same question for the post-survey link too. Just about thoughts after the presentation.
Okay.
Well, I have a question.
Yeah.
Would you all like to buy chicken dinner on December? Any deliverable to the hospital?
What day is it?
December 15th.
Let me see. Can I take your email and I'll let you know? I'll look at my calendar.
Can we
Gammy Singer 5 at gmail.com.
Is there going to be a flyer or something about the dinner? I can always forward it to Olivia and Carl.
Oh, yeah.
can I just say something, please? We got ahead of ourselves because we have that on the agenda.
Okay, great.
That's why we have the agenda.
I'm just trying to get to, get a little sales going, Maud.
I know.
Since I'm right next to the hospital.
Did you have any questions, Maud?
No, I
Okay.
don't.
Great. All right. If no one else has any questions, well, I just want to say you can always email us. Our emails are in the chat. I'll make sure to send that to Harriet too, so that can be sent out again. And so please reach if you know someone else you think that could use some assistance, or just even if just a phone call just to talk about some different thoughts they might have around it. We're more than happy to do that. Or if you know of anyone else that you think could use this presentation, or we are more than happy to do this one again with you guys, or just go anywhere else. Especially trying to reach young families, that I know that's a big one too. So if you wouldn't mind pushing that information out to them, that'd be great as well. And yeah, thank you so much for having us. It's been really nice to be with you all, and such great questions and nice community. And I appreciate all the work that you do. I see you a lot of people at different tabling events, so it's nice to see you here too.
Thank you so much, Olivia.
Yeah.
Thank you, Carl.
You're very welcome. Thank you for having us. And if, like I said, I'm here Monday through Friday. If you need me, reach out to me. I'll be more than happy to answer anything I can.
Thank you.
And then, sorry, I do have one last question for you, Harriet. Would it be possible to get a list of everyone that's on this call afterwards, or should I try to get that now?
Madeline, can you? It'll be in the minutes, right? You know what? Olivia, I'll jot it down. I thought Madeline is our secretary and she usually writes a list of who's here, but I don't. She's not responding to me, so I'll write it down and I'll send it to you.
Okay, thank you so much. Perfect.
Yep.
Okay, we at announcements, and Kazoo, you had a question about the dinner?
Is
Do everybody
Kazoo?
see the agenda?
Yeah, Kazoo, you're muted if you're trying
I
to.
think I lost it. I think I done lost
Okay.
something. I can't get back.
Sorry. No, I was going to just offer my help,
Oh, okay.
and I can call Madeline about that. Madeline.
What happened to Madeline? Is she still
She
with
may have,
us?
she may have gone to the bathroom or whatever. I think she's still on the line, but she's just not responding. She might have stepped away.
Yeah, that's okay.
I believe it tells you on the agenda when the dinner would take place.
Right.
December the 15th at the St. Paul Zion Church. We didn't give a time of what time the dinner would start, but I think we usually start between 9 o'clock and 10 o'clock if we got to fry that chicken. And dinner start going out at 11. But at our next meeting is December the 8th, and we will get that cleared up. And then our flyers will go out about the dinner.
Yeah, I might be in Ohio. So
On December the 15th?
yeah,
Well, that's when the dinner take place.
I know. That's why I have to wait to find out. Sarita went to move to Ohio. So yes, I will call in. I'll speak and make a decision. Thank you.
Okay, what's next on the agenda, Harriet? 'Cause I lost my stream.
New York State NAACP membership meeting will be held on Thursday, November 30th at 7 p.m. on Zoom.
You already mentioned that.
Oh, okay. And then last, number 3 is planning for the Reverend Dr. Martin Luther King Community Program. That'll be in December 2023. Is that the planning meeting, I assume?
Yeah, but we didn't
Yeah.
set the date, and we always have that planning meeting at the Christ Ministry Baptist Church on Market Street. And the clergy that wish to attend will be there. Most of the time, we have 3 clergy that come for the planning of that program.
Okay, and you still haven't fixed the date.
No, for the meeting, no.
Okay, but it'll be in December, and
It'll
then
be in December.
great. And then finally, NAACP first state quarterly meeting will be held Saturday, January 13th, 2024. Place and time to be announced.
Yes.
Hey.
What's the matter?
Oh, I'm sorry. I forgot I was not muted. Just some pains. I'm sorry.
That's it?
Yeah, yes, then it says adjourn.
Okay, and all of our executive board meetings executive board members know our next executive board meeting will be the first Monday in December. I don't know the date right now. I think it's run, but it's in December. I will go pick up the chicken. The chicken have to be picked up. I have to call Murray and let them know what date we want to pick the chicken up. But if I go by myself to pick that chicken up, they will they'll put it in the car. But when I get to the church, of where, somebody need to be there to help get that chicken out the car. We need some men because I won't be able to lift that chicken. We need some men to help us lift that chicken and put it in the church. So.
Okay. The first Monday in December is the 4th.
Well, that would be our next executive board meeting, and we'll
Okay.
talk more about this dinner. And I think Molly volunteered to do the flyers, right, Molly? Did she go off?
sorry. I did volunteer to do the flyers. I just need to confirm that we are having it at the place we discussed, and we need to agree on the price.
Yeah, we have already got clarification that we can have it at the church.
Okay.
Yeah.
And the price? Did we?
Well, we didn't really, did we sell on a price at our last meeting?
I thought we were going to bring that to the, Gammy, you're muted.
At the next executive meeting?
I thought it was at this meeting, we would bring it to the membership.
Oh, okay. Well, we missed it, right? We posted. So what do you all think we should charge? For the dinner?
I believe that we should charge the 1968 in honor of the founding of the Ellenville NAACP branch in 1968. I don't think that's too much to ask, but for some of the people that were not on the last executive committee meeting, what do you think? Like iPhone 2 and Olivia, would you stretch to $19 for a chicken dinner?
I think she might have went off.
Oh, I'm still here. I mean, that's something I think I would be able to do, but I wouldn't want to speak for, I guess, the whole community on that.
Sure.
But yeah.
That seems reasonable.
I feel like it's reasonable. I feel like I paid that today for a good lunch. So
I mean,
Oh,
also
yeah.
it's dessert. I mean, it's the whole kit and caboodle.
Yeah.
I don't, you know, where can you get for under $20 a dinner with dessert? Really?
You can't. That's a really reasonable price.
Gammy, what
Well,
are you saying? You're muted.
What do you think, Gammy?
Gammy, we can't hear you. Gammy, we can't hear you.
Not talking.
Gammy, you're on mute.
Hello?
Tammy, you gotta unmute.
Gammy,
Maybe
I think it's reasonable, but we'll probably have to round off that figure to $20, right? Because
that's
of
what I
the
figured.
change factor.
$20. Yeah.
We'll say 19, whatever it is, 68 on the poster and whatever, and then in little print, round it off to 20. Okay.
Okay.
And we deliver, so that's
Yeah.
all part of it, you know.
So about the delivery, I don't know if Maud is still here, but I think it'll just have to be an email to the general membership seeking volunteers to assist Maud with carrying the product into the facility and to.
I'm not gonna carry that chicken. That chicken be heavy.
Yes.
So I would see if I could get some men to come to meet me, if nobody else go with me, to meet me at the church to lift that chicken, cause that chicken is heavy.
We also need people to volunteer to make deliveries. So we have a list of 80 members. That should just be a mass email to all 80.
But
Yeah.
did you remember what I said before? That 3/4 of our members do not live in Ellenville?
And that is fine. And when people volunteer, they make the time and they spend the effort to go outside of their communities. But
So
if we don't ask, we won't know. We have to ask.
No, but then the
I'm
email will have to be sent out. The email will have to be sent out to all the members to get volunteers to
Sure.
come.
I'm delivering
little
food on the 15th from Saugerties. I mean, you know, it's only one day. It's not like you're asking
Yes.
people to do things all the time.
Yeah.
Right.
and people
So-
come to pick it up.
So
Remember-
Molly, what I'm saying is that the secretary will have to get the information to the whole membership asking who would like to volunteer.
Yes.
So we'll know
Yes.
who would be volunteer.
Yes.
And at our next meeting, that's when we can finalize the price and then the flyers can be put out.
Yes.
Right.
Can I, this is
I think
Kazu.
the planning meeting
Can I-
is on the
Gammy,
December
the 8th, right. That's the
Yeah.
next planning meeting.
I'm just gonna
And
jump in
I'm
quick because
sure
Carl and I
can-
are gonna
we can
sign off.
get some young people.
Thank you,
to
guys.
help
Bye,
with
Thank you so
Olivia.
much. Have a good night and enjoy your
night.
meeting.
Good
Bye.
night, Carl.
Good night. Thank you all.
Thank you.
What time? So is this dinner gonna be?
Voicemail system. Please dial your mailbox number or group mailbox number, then press pound.
that?
Whoever is a host can mute that, yeah.
Oh, I think he took care of it, although he's still
Please
there.
dial
He
your
didn't.
mailbox number or group
Okay,
mailbox
hold on, I'll
number,
do that.
then press pound.
Give me a second. I'll mute him.
So
So
we have,
this dinner,
Can I-
if you don't mind me asking, this is gonna both be a sit-down dinner at a specific location, and then also you're gonna deliver meals? Is that
It's not
correct?
gonna be, it's not gonna be a sit
Takeout.
down dinner.
It's a pick
Oh,
or
oh,
delivery.
people
up
pick
or
it up.
deliver.
Oh, and what's the time span that you make this available?
We'll start serving at 11 o'clock. That's when we usually do. But
Oh,
you have to
okay,
start cooking at 9 o'clock. We have to be at the church at 9 o'clock because we have
Okay.
a lot of chicken we will have to cook.
yeah,
Yeah.
And everything else is being donated, you know, like the vegetables, the cornbread, all of that'll be cooked at the person's house that will be donating. But we have
Okay.
to fry the chicken at the church.
got it,
That's
okay.
what Madeline's list is about. All
And
the
what
people
time,
donating.
right, and what time is the last time people can come and pick up this dinner?
Well,
Or-
we'll start, it'll be from 11 till 4 in the afternoon.
Okay, all right,
And it's on a Friday.
okay.
The 15th is on a Friday.
Okay. Anything else?
did we have a next chicken planning committee meeting in addition to the next?
The 8th.
I think we said December the 8th.
Okay, all right.
I think, but you know, our executive board meeting is before that.
Right.
It should be before December the 8th.
Well, we'll finalize all the details on the 8th.
What I'm saying, our executive board meeting is the first Monday. So that's the second or the third. So it should come up at our executive board meeting. Because after the executive board meeting, then come the 8th, and that's the next meeting we're supposed to have with the chicken dinner.
Well, what
Right.
I was saying is that we could just, you know, have input from the executive board, but then the 8th meeting would be to finalize everything.
Yeah. Yeah. So instead of having it on the 8th, could we move that chicken committee meeting to December 1st? Which is 1 week prior, that Friday before the planning Friday?
But then there's a
December
long
the
time
1st is on
between
what
the
day?
1st and the 15th, so.
Oh, but the 1st is December 1st would be for the chicken committee to meet again.
Yes.
And then December 4th would be the executive meeting to finalize
That sounds good.
everything. Okay.
Okay, you know, Madeline is the chair, so you better.
Well, Gammon, we are on now. We got to make a decision tonight.
Yeah, I'm just saying, you didn't let me finish, Maud. I said you need to let her know
Yeah.
that you're changing the date, because it might not, you know.
Okay.
Yeah.
So I'll let her know, or Molly can let her know that we want to have it.
What day?
Harriet is the assistant secretary. So Harriet, you can let Madeline know that we want to have the next meeting instead of December the 8th, we want to have it December the 1st.
Okay,
To finalize everything before, and then we'll talk about it again at our executive board meeting, which is December the 4th.
And that'll be
Okay.
at 10 o'clock again, 10 in the morning,
Yes.
right?
December
10 in the morning.
December the 1st should be 10 in the morning.
Okay.
and
So
where do
can
you
let
meet?
Huh?
Do you meet him? Do you meet?
Zoom.
Oh, it's a
Zoom.
Zoom meeting? Okay, I'll tell Madeline.
Who
Uh,
will run the Zoom meeting?
Okay.
what was that? When we also need to ask Madeline about sending out that email to the general membership for volunteers. We know we're gonna need to.
We could do that at the December the 1st meeting.
Okay,
Got the dinner not till the 15th.
okay.
She probably needs to check that email thing because there was a kind of slip up this meeting. So just to make sure the word is getting out, because I didn't get any, and I still don't have any from when she sent tonight. So I don't know
You
what
mean about
that's
the
about.
information for this meeting?
Yeah.
I didn't get it either.
And then she said she was going to send something else, right?
Hmm.
Anyway, but I did get a list, the
The food list,
the
yeah.
sign up list, but I didn't get the other report. So I don't know what that's about.
Okay, Harriet, could you follow up and send Madeline the information about, instead of December the 8th, our next meeting will be December the 1st in reference to the chicken dinner?
Yes, I'm gonna email her as soon as we're done, and probably she'll want to know how we wrapped up the meeting because she's gone. I don't know what happened to her. Also, I just want to say that Cheryl wrote in the chat, I will volunteer to deliver and have my son as one man to meet and carry in chicken to church.
And I
Thank you,
privately
thank you,
chatted, I
Cheryl.
privately chatted her saying, email Madeline, who's keeping track of volunteers.
Yeah, good idea. But I can mention it to Madeline when I send her this email. Great.
And Cheryl, maybe you would want to ride over with me to pick up the chicken?
I will.
I have to pick it up like the 14th, the day before the dinner.
That's fine.
Okay.
Okay.
That's that, guys.
Okay, that is nothing else. Anybody else have anything to say? If not, it's the
Turkey, turkey, turkey.
Happy Thanksgiving, everyone.
thank
Have a
you.
great,
Thank
and
you.
may you all have
Thank
great
you.
things to be thankful
Thank
for.
you. We gonna take all of Molly's great cheer with us all the way the rest of the week.
Yes.
Bye. Good night.
See you guys.
Bye.
Bye-bye.
Bye.